Hi everyone, my name is Maritza Lopez. I'm one of the medical providers here at Starling Diagnostics, and I'm here to talk to you about the annual mammogram and why they're so important. The machine that you see next to me is a mammography machine, and it's a 3D mammography machine that can be used for both diagnostic mammograms and for screening mammograms. The purpose of this video is to kind of debunk a few maybe misfacts or concerns that we may have as patients, parents, mothers, sisters, or women in general about mammograms. So starting off with the compression. A lot of people are concerned about how much your breast is compressed during a mammogram and will it hurt? What I want to explain is that it is necessary to have some level of compression of the breast, and that is necessary in order to flatten the breast. When we flatten the breast, we're able to see small calcifications and very small lumps that you cannot detect on your breast physical exam that you do with your hands. The other more important thing is when we flatten the breast is we get less radiation because we make the breast smaller. This is also important because we want to reduce the amount of radiation to the breast at all costs as much as possible.
Hey Maritza, how you doing? This is Abdul. I just want to ask you a couple of questions. Is that okay? Well, you're there. So how old should I be when a person, a woman, should get the breast examination?
Sure, that's a great question.
Does everyone get it, or?
So we'd like to start screening annually after the age of 40. That is the baseline. However, if you have risk factors such as a gene mutation called the BRCA gene mutation, breast cancer screening should start earlier. And that's something you can talk to your doctor about. Usually we start those around age 30. Also, if there's a big family history of breast cancer, especially in the patient's mother, sister, or daughter, that is another reason to start breast cancer screening earlier.
So is there any way people can do a self-detection as well along with mammogram?
Yes, in general we always recommend that women do a self breast examination every month. What we see is compliance with that is not too good, and also I'd like to remind people that one of the purposes of this again is to detect masses that we cannot feel. So although it is important to do a self exam, it is not sufficient in detecting even small masses, and detecting masses that are very small and early are our best way to treat and fight against breast cancer.
And let me ask you one other question. Is breast cancer one of the prominent cancers in women's health as far as we understand?
Yes, it is one of the most prominent, and in fact, most women, about 75% of women who are diagnosed with breast cancer annually, actually do not have a family history or a BRCA gene mutation. So these are all new people being diagnosed.
Can you explain us a little bit about the stages of the cancer? Let's say suddenly you got got your mammogram done at Starling Diagnostics and you get abnormal findings. What does that mean? Does it automatically mean, oh my God, I have cancer and I'm gonna, does it really mean?
That's a great question. So in general, if we ever find any lump, 100% you want to go to your doctor to have it checked out regardless of your age or your family history. Okay. But I'm sorry, one more time, what was your question?
Yeah, so can you explain the stages?
Oh, the stages, yeah. So mammogram machines are really, really great. They can detect microcalcifications. That means microscope. So small we can't see or feel with our normal eyes or our hands. Therefore, catching it early, this would be like stage 1. First, we do a screening. If the screening sees anything, we might get an additional mammogram that's called a diagnostic. That takes more pictures and more in-depth look at the areas in question. And also, we usually order something called an ultrasound. That way we have kind of 2 different imaging modalities to look at a specific area that might be in question.
So as a woman, if you're basically doing it correct, it's early detection, and it's one of those rare cancers. It could be, if it's detected, could be resolved, and it's not life-threatening. And
yes.
From there, right?
So what we know is if it's early, if it's caught very early, the chances of eradicating it and putting the person in remission and the person living a pretty healthy, normal life is very high.
All right, great. Thank you very much. And you are here in Starling Diagnostics 5 days a week?
Yes.
Thank you very much.
Here.
Thank you. Bye.
Okay.